Hey, how you doing? Welcome to the Easy Breathe Open Enrollment webinar. That is right, I said Easy Breathe. So if you thought this was going to be about something else, then you might be in the wrong place. But if you came here to hear a little bit about what's going on for open enrollment and some of your medical plans, then you got it locked. You're in the right place. On your screen, you should see something for a fake employee by the name of Chuck Zest. I am not Chuck Zest. I don't even think there is an employee in your office building named Chuck Zest. But you may have heard of the insurance broker Chuck Best. That's actually not me. I'm Jonathan Rudnick, but you may have talked to Chuck Best, not Chuck Zest, one time before. Now, it's hard to believe. It is 2020, and we are at open enrollment. So that's one of the reasons why I thought it important that maybe we have a webinar. That way, maybe and hopefully some of the questions that you were thinking about, or maybe even a refresher of getting into the web portal, is some of the stuff that we can offer you just in this little tidbit in this video, and knock out some of those easy questions. But if it doesn't, you can reach out to us by phone to one of the insurance guys in the office. We are working remotely, but the number is still the same. It is still 818-883-3282, or you can shoot us an email, however you feel most comfortable. I know a lot of the times when we do some of these open enrollment meetings and I do a webinar, or I'm doing these in person, somebody has a really specific question or a personal question, and they really can't ask any of those in front of other people anyways. So that's great. Just reach out to us, sometime during the open enrollment process, and just make sure that, you get your question answered. One of the things that I think is super important to mention is that this is your time to make changes to your plan, add or delete the dependents. Every year, the carriers will decide to either, not to support a plan, or they will modify a plan. And that could mean, maybe copays have changed, deductibles have changed, maybe the out-of-pocket has changed, maybe your plan doesn't even exist anymore. In addition to that, you may need to add a dependent on. Maybe they were on your spouse's plan before, and now you want them to be on your plan. So there are a couple things that you should do, while you're going through the portal process. And what you should be able to see here, if you're looking at the screen, is there's an opportunity for me to look at my profile, or check out my dependents. You should make sure that in your profile that your address is updated. If everything's the same, that's great. You're ahead of the game. If you're brand new and just enrolling for the first time, you'll go through and you'll enter your information into your profile. It won't even let you go forward until you do that. When it comes to the dependents section, if you have no dependents, obviously there's no reason to put anybody in either for this year or even during the enrollment process as a first timer. But if you do want a dependent or the cost for that dependent to show up along the way, you do have to add them in, and then you just go ahead and you waive them for whatever product you don't want them to be involved in. So keep that in mind, because that's the only way to get the cost to show up on the other side of the screen. The first thing that you should see when you're logging in, one of the first tabs after you got past profile and dependents and some of that information, is your benefit allowance. And that's going to show up, and that's going to be your money, your bucket of money to go ahead and use towards your benefits. And what I like about this approach is it's going to show you everything that you've signed up for on the right-hand side of the screen, like a shopping cart. And then down below, it's going to show your allowance being applied to that amount. So you will get your net amount, and it will show you if there's anything remaining. In this case, it doesn't show anything remaining, just because the cost of the plans are much higher than the contribution amount. The other thing to keep in mind is that the mode inside your portal, this particular one happens to be monthly, but for a lot of the employees, depending on whether you've reached out to me or not, this might actually match right with how you're already doing your payroll deductions. So don't be confused by that. Don't think that you're having a $1,200 per week contribution. Just keep an eye on what it says as per pay period, so you know that what's going on inside your portal. So once you are there and you've seen that, right, we're going to hit continue. and it's now going to move us on to the benefits tab. All right. In this webinar, if I haven't mentioned it already, is I'm going to go over mainly the medical portion so that I can keep this kind of short and simple and make sure that you're going in the right direction. I don't think this is going to take the place of any specific, question that you might have, but I do think it's going to answer some questions. And like I said, kind of get you going. Since this is your opportunity to sign up for a plan, there is no really pre-existing condition or anything like that that you have to worry about. So you can go from one Anthem plan to another, or to Kaiser, or from Kaiser back to Anthem. None of that stuff matters, so don't worry about not being able to apply for a plan because something's going on. None of that stuff exists because of healthcare reform. And once again, this is your opportunity to go ahead and make those choices. So that's why I think it's super important. Sometimes employees don't think of their coverage this way, but I really do want you to think of it this way. And what I mean is that every year you have this opportunity to select your plan. So maybe last year, right, you didn't need to go to the doctor all that much, right? And this year you were thinking about, you need to have a scheduled surgery. Maybe there's something you need to do with your ankle, your elbow, your shoulder, something like that. Well, take advantage of that. There are going to be doctors that you need to get to, right? And they may not be in the network of the plan that you chose last year, or maybe you had to get a referral under the HMO, and this year, you want to go with a PPO where you're not going to need a referral. All right, these are different things that you want to think about as you go through this process. I've put little notes in here, along the way to help you, but once again, you may have forgotten all this from the last time, we had some of our conversations. There have been a lot of other things on our mind, so I completely understand, and don't worry, we're here to answer all those questions by phone or email. So definitely reach out to us if you're stuck on some of this. So let me highlight a couple things for you as we're going through this. Keep in mind that for Anthem, right, there's a select HMO network, a HMO network, and a PPO network. And then for Kaiser, there is just Kaiser. Now, with Anthem, the select HMO is actually a smaller network of providers. So if you're thinking right off the bat, I need to go to Cedars or UCLA, that's not going to be in the select HMO network, right? There are plenty of other medical groups in there, but that major one is not in there. So just keep that in mind because it's super important if you're trying to get to specific people this year. If you look at the regular HMO or what they call California Care, so keep that California Care, that's going to have the largest HMO network that Anthem has. So that is going to have Cedars or UCLA, and you can sign up with providers directly, with that network. So keep that in mind if you're trying to get to somebody different. If you're talking about the Anthem PPO network, it's not required that you pick a provider today. It is recommended that you try and find providers when you're going to utilize services to stay in network, right? So definitely do that to cut down on costs. Because remember, yes, you can see out-of-network providers on a PPO, but they have no contract with that particular provider. So that just means it's going to cost you more. There are plenty of providers, in the network. So try and stick with some of those to keep your costs down. And if you're going with Kaiser, of course you have to stay within the Kaiser network. There is no going outside of the Kaiser network. So keep that in mind. One of the little notes that I put here is that you do not have to reselect your primary care provider. That is only necessary if you're moving, from, one network to another, right? Sometimes it's just important to reaffirm who that's going to be if you're going from one plan, even though you're going from California Care to another California Care. So keep that in perspective. All right. I love it when you have those little pop-ups. Very interesting to me that they always pop up on the screen. Okay. The other thing that I think it's important to mention is that the deductible. So this is something that people get stuck on every year. All the deductibles are calendar year. So I know this is a point of confusion. We do our open enrollment. It happens in July. All of your plans go into effect August 1. So ding, 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 ding. One question answered right there. But the deductibles, right, are calendar year. So that means your deductible actually resets, right, in January, not in August. So keep that in mind. Super important as you're going through this process, just so you can keep an eye on where things are. If you have a particular situation or scenario you want to go over, just let me know, but it's important that you keep that in mind. All right, I've included a couple videos. Once I get done with this webinar, it'll actually be added in here as well. So you will see that as you're going through everything, but you just don't see it right now. So I've included one that's the difference between an HMO and a PPO. I've also included one that explains a little bit about Kaiser, and I've included one additional video about Kaiser, and it was how to talk to my children about COVID-19. I just thought that was an interesting thing. Anybody can really check that out and just see what's going on. So I would keep that in mind as you're going through some of this information. You might want to give it the once over. Down below though, however, right, this is where all of your plans are going to be located. So when you're going through this, one thing that for some reason seems to be a point of confusion in addition to everything else that goes on is this button. If you have this here and it's selected like this, you are waiving. But in order to see the plans and see the cost of everything in the correct manner, you do have to click Enroll. So depending on how you're going to set this up, whether you're going to include your spouse or waive your spouse, you're going to give us a reason if you need to waive your spouse or any other dependents. That's just so we can keep tabs on where that person might be going for coverage. So if you need help later on the year, we know exactly what to do. The other thing I want you to keep in mind for this year is that you can compare the plans. Now, this isn't new. We've been able to compare the plans for a few years now. But this is just one of these things, right, is a way to go. So when you hit the compare plans, all the plans are going to come up. And if Chuck Zest was actually employed with the company last year, you would have seen his plan from last year come up here in the first column, making it easier to compare. Now, there are quite a few plans, so don't get me wrong. If you're only concerned about seeing Kaiser plans, you're going to want to take this next step. Down at the bottom, there's an export to Excel function that will export all of the plans to Excel. And then you can just eliminate plans that are not relevant to you. All right, you're going to have to explain the plans because there are quite a few of them, but that's a really good method. But if you're just looking at, a few plans here and just want to see what's going on, you can scroll from right to left and you can go through all of them. And so this is kind of a nice feature. It keeps the cost of the plan up at the top. And, without this, I think a lot of people would be lost because they want to know the difference between Kaiser Gold and maybe Gold Select HMO Network. That's a good way to compare things and with cost and deductibles and different things like that. All right, so you just click off of that if you want to move forward. And then you go through this and you're going to look through the different plans and the different things. Now, what you're going to see in here is there are a whole bunch of different things that may or may not have been in the portal last year. And the reason why I say that is that Kaiser has actually put together a much more comprehensive list of preventative care services this year that wasn't available last year. I mean, it's not that they didn't have preventative services, it's just that they didn't have a list that you could take a look at. So you're able to click here and see that some of the preventative care that goes on beyond the age of 40, for example, what some of those other services are. I'm sure that all of you know by now that after healthcare reform came in that you all will get an annual physical, right? That annual physical, right, is available to everybody every year. So take advantage of it. That's going to get your blood work, probably going to give you some information about, cholesterol and if you're in danger of, having diabetes, things like that. But as you get older, once you get into your 40s, there are different preventative care exams. For men, it could be a PSA test. For women, mammogram tests. And when you get to 50, this could be a colonoscopy. So keep all of that in mind. These are all provided under the preventative care scenarios by each insurance carrier, not just with Kaiser, but also with Anthem. Keep in mind also that if you go into the doctor's office and you happen to have a cold or something like that, but you're originally scheduled for an annual physical, they are going to change things around. And what originally would have started out as a free visit, no copay whatsoever, they may now see this as a diagnostic rather than preventative care visit and then charge you a copay. It's the number one thing people ask me about, and they say, hey, why did I get charged for this? and this is the reason. So try and, separate those items out. At least that way you'll be able to keep it straight, when you go to pay for the copay. Vis-a-vis, if you're going in for an annual physical and they ask you for a copay, just tell them, whoa, whoa, whoa there, buddy. I don't think I have to pay for this, right? And it will get them to check their records, because sometimes you will go into the doctor's office and trying to get back some of those copays, even when they make an error, can sometimes be difficult. You will notice that with every level of coverage, there's going to be a summary of benefits and coverage. This is an SBC. It is an official document. This is something that when we went into healthcare reform, they wanted to make one document that everybody could see no matter what insurance company they were going with, and that it would look very similar. That way, it wouldn't be very hard to distinguish certain benefits as you go from one plan to the other. And this is going to list, the deductible, and it's going to give you some information, on what this applies to. It's going to let you know if there's a deductible for prescriptions, right? And as you scroll down the list, right, there's a whole bunch of other things here. It's going to let you know what a primary care visit is, a specialist visit, different items like this as you're going down the list. Maybe you want to know if a diagnostic test is co-insurance, right, or a copay, right? All different kind of things that you can have, at your disposal to help you make a choice between one plan and another. And this is how you do it, because you may be completely interested in what does it cost for testing, but you may be less concerned about, what it is for me to go to the doctor all the time. Or, maybe you're concerned about hospitalization because you're going to have a baby and you want to look at that over here on this tab, and you see that this is 40% co-insurance, and you're like, hey, if I have a baby, how's this going to work out for me? That is what is the purpose of these SBCs, to kind of get you going in the right direction. Now, I'm not going to say that you're going to learn everything from looking at this, but this is a good highlight reel to see some of the most important benefits that are there. So when we flip back over here, we can scroll down. We did our best to organize all of these plans from lowest cost plan to most expensive plan. So keep that in mind when you're scrolling through it. When we get down, and let me just get to an Anthem plan. So we'll get right here. Anthem Silver Select HMO. Once again, remember, this is the Select HMO network. So it refers to a specific network of doctors. That is the doctor's network if you're going to search where you're going to find things, okay? Once again, the SBC is listed there. We do have a provider search button. This will help you get in there, but that provider search will not be helpful to you if you do not put in Select HMO as your primary plan. You might get the wrong doctors and think that you're enrolled with the correct ones, and you just simply aren't. So I would caution you, just reach out to us if you're concerned. There are quite a few selections. When you go to Anthem, when this comes up right here, you'll see there's a lot of different things that you have to do to get through it. Not impossible, but it's just a little bit different than looking at your ones for some of the other insurance providers. So keep that in mind. We can help you get through it and help you, find the right doctors and make sure that they're in your network. All right. This is another little cheat sheet to help you find out, how to get to the providers and go through everything. So this is one of the things that I would take you through, just depending on, where you're at. And just remember, right, there's a difference between Blue Cross CA Care, right, and Select HMO, and then Blue Cross PPO, all right? So these are some tips and tricks to get you through it. Another thing that's important is that today a lot of people are doing telemedicine, because as you can realize, sitting in a doctor's office does not seem super attractive right now. Now, I realize that if you're sick or something's going on, you're definitely going. But there are a couple of those scenarios where you're like, oh, I have allergies, or, I am just not feeling 100%, but it's not pandemic related. It may not be COVID-19. It's just one of these things where you need to get a prescription. A lot of that stuff, both with Kaiser and with Anthem, is being done through telemedicine. So I would, take a look, at this mobile health flyer, take a look at how you have to register to get things going. Make sure you download the app. And this is one of those things where you might be able to save time and energy, and possibly, even get certain prescriptions and different things sent directly to you, right? Like a prescription set up at the pharmacy where you just have to go there to the pharmacy and you bypass having to go to the doctor's office. So take a look at these different flyers, telemedicine, all the different help options. This is the way things are really being done right now. And the cost, a lot of times, sometimes isn't even as much as going to the doctor, right? So go ahead and do this, check it out, reach out to us if you have any other questions about it. But I think this is a great way to go and maybe eliminate you having to go to the doctor. Don't forget that regardless of whether you're on, the HMO or the PPO, you may end up and want to go to an urgent care facility. So if you're with an HMO, you want to locate those from the get-go. Hey, where is my urgent care facility? With Kaiser, you want to locate where's my nearest urgent care facility. And with the PPO, you want to do that as well, because between the PPO with Anthem and the HMO with Anthem, there could be different urgent care facilities that you're eligible to go to. So I would say figure out what those are from the beginning, and then when you really have to go, there really isn't a whole lot of discussion that you have to do. So I think that's one of those really great things to get you going. You can see here, right, here's the silver HMO once again, but this one is California Care. So a lot of people say, okay, well, I realize there's two different networks, but are the benefits different? No, that's the great thing about this. You can get a high level benefit plan with Anthem and be on the select network, right? Has same benefits as the California Care network, but California Care is really just getting you to UCLA and Cedars-Sinai. Those are the two most expensive facilities right now, especially in Southern California, right? So keep that in mind when you're going through your care, because if you're not going to go utilize doctors over there, you may not want to enroll in that plan. So keep an eye on it. Make sure you know what's going on. After we have selected our plan, right, I'll select this one right here. Let me just scroll down to the bottom. Sorry for making you sick right now. It's going to ask me, for an ID. If I have one, already, no problem. I would just say keep the same here, keep the same, and put in a couple zeros just so we know that you're already there, okay? For me, because I don't have anything checked out here, I'm just going to do auto assign, which is another thing that you can do, all right? And I'm going to hit continue, right? So that was pretty easy and simple. That's all we really needed to do to go ahead and get through the medical plan selection process. So once again, right before we log off for today, just keep in mind, right, that this plan selection that you're doing is for the entire year. So if you come back and you want to switch from the Select HMO to the California Care HMO or to the PPO later on in the year, we can't do that. And I would love to be able to do that, but that's actually something that the insurance carrier is not allowing us to do. So even if you go to the HR department and tell them, hey, I've really got this issue and I really got to get to this doctor, right? They aren't going to let us switch those networks. So it's important to keep an eye on what it is that you're thinking about doing, for this year. Make sure, maybe some of the hospitals are affiliated to, where you are, especially if you have a planned surgery, right? If we're just talking about, emergencies, you really don't have to worry. No matter what plan you're on, whether we're talking about the PPO or any of the HMOs with Anthem, or even if we're talking about Kaiser, remember, when we're talking about emergency, they are taking you to the nearest hospital. So it could be a funny thing that you're on Anthem, but you're closest to the Kaiser Hospital on Sunset. That is where they're taking you. And so that will be where you end up until they stabilize you. So if for some reason they have to do immediate brain surgery on you, they're going to do all of that at that particular Kaiser Hospital, right? Which, funny enough, I think that is where they do some of those operations, in the Sunset facility, rather than out, in Woodland Hills, for example. And then when they stabilize you, they will move you back to a hospital that is affiliated with Anthem. So keep that in mind, right? You are covered for emergencies. You're all good to go there. If you do have to travel for whatever reason, I know they're really not allowing us to do as much of that right now, but if you did happen to be in another state, you're still covered for emergencies. right? Things are a little bit different when you're talking about the PPO versus the HMO, but you're still covered for emergencies on both plans. On the PPO, it's slightly different just because in other states under the Anthem PPO, under the Blue Card network, you will actually be able to use your plan the same way as you would, right, as if you're in California, if they have an affiliated, network in that particular state. And they do have a pretty big national network, under Anthem. So you can keep that in mind. I know it's kind of the furthest thing, in our thought process right now. Traveling, wanting to go somewhere is different from being able to go somewhere, and especially safely. So just know that you're protected. Another thing that you might have on your mind is stuff to do with COVID-19. The insurance carriers are updating, their different rules with this, all the time. The going thing for the moment was that most of the tests are going to be covered for COVID-19, as is the treatment. But they have been updating this. So I would just, give us a call if something's going on. I think this is really great because you may be worried in your mind that you're going to have this $18 million bill from being on a ventilator, which I hope none of you ever, get into that scenario, but you will not. Number one, you have an out-of-pocket on your plan, so you don't even have to worry about it. It shouldn't even be a thought in your mind. But number two, the insurance companies up until this point have covered all the costs for COVID-19, including some of these hospital stays. So you don't really have to worry about that part of the scenario. But I would definitely check in with us throughout the year, because as the year goes on and things change with the pandemic, maybe they get it more under control. I can imagine that some of their processes, could change, or infrastructure, for some of that. So, once again, I'm going to end this webinar, and I hope that you got a lot out of it just to get you going. Our telephone number is 818-883-3282. Hasn't changed in 20 years. My email address is jrudnick@LA, F as in Frank, I as in insurance, N as in Nancy, services spelled out with an S.com. So jrudnick@lafinservices.com. You can definitely shoot me an email. Let me know what's going on with you. I hope that everything's well. I hope that you guys are staying safe out there. And just know, if anything's going on, just reach out to us as soon as possible. We want to help you out and, make sure that you're okay. That's all for now, and be sure to check out some of our other videos with regards to some of the ancillary products. Have a good day or evening.